There we go. Okay, this session is called Taking the Lead on Global Health. We have three really, truly remarkable leaders in global health with us, one of which I'm going to introduce first, Victor Zhao, traveled through the dead of night and the snow over Independence Pass to be with us. So he's our hero, Victor Zhao. Victor's been coming here for many years, and he's really a part of the Aspen Ideas family. So Victor is president of the National Academy of Medicine since 2014. He was previously Chancellor for Health Affairs and President and CEO of Duke University Health System. He's a professor at Harvard Medical School, Chair of Medicine and Research Director at Brigham and Women's Hospital, and Chair of Medicine at Stanford University. Among the many other things that Victor has done in his lifetime, and he looks so young, so I'm not sure how this is possible, but his research laid the foundation for development of inhibitors that are used to treat high blood pressure and congestive heart failure, and he pioneered gene therapy for vascular disease. He's also a board member of Singapore Health Services, and his numerous honors include the Distinguished Scientist Award of the American Heart Association. So welcome, Victor.
Thank you.
Thank you for being with us. Victor was also recently in January at the opening of the world's first University of Global Health Equity. And the beauty in between the two very brilliant gentlemen, as also both brains and beauty, is Dr. Agnes Benoit. And let me just begin by saying I would follow Agnes anywhere. She's a visionary in global health. She was the Minister of Health in Rwanda and led that country from a post-genocide situation, which is hard for most of us to imagine, to literally being among the top 5 of achievers in global health. She was personally responsible for beating back the Ebola crisis, for reducing child mortality, reducing maternal mortality, and she, in many ways, paved the way for Rwanda's leadership in terms of numbers of women in parliament. With President Kagame, she was a very, very big part of rebuilding that country into the model that it is today. What she's doing right now is she's a pediatrician, she's a vice chancellor, but she is the chancellor of the University of Global Health Equity. It's in the hills of Rwanda. It's beautiful. It's near Butaro Hospital, one of the first human-centered design hospitals in the world. They are bringing students from Africa, as well as all over the world, to work on what she's calling global health equity. So she will tell us more about that. She's also a big dreamer, and so she'll share some of those ideas with you today. And then Robert Newman. Robert also traveled through the dead of night to be with us. I think he bribed the Lufthansa agents. We don't know. He has some special status, but all the frequent flyer miles he's accumulated, he used last night to get on the last plane. 50% of flights out of Denver were canceled yesterday. So you all are heroes. But I have the very great honor of working with Robert now as he's the head of our Aspen Management Partnership for Health, AMP Health, which is a unique program. Many of our colleagues are here today in the room, which is really focusing on the importance of leadership and management in ministries of health throughout Africa and Asia. A pediatrician with more than 25 years experience in global health. He's also a senior associate in global health policy at the Center for Strategic and International Studies. He's a clinical professor of global health at University of Washington. His previous roles include the global head of tuberculosis at Johnson & Johnson. He was CDC's Cambodia country director. He was managing director for policy at the Global Alliance for Vaccines, and he's also director of WHO's Global Malaria Program. I better stop there because it goes on for a long time. But he was in Mozambique many, many years ago, beginning some of his work in global health, and will likely be in Mozambique again post the cyclone there. So our focus for today is this. Those of you in the room may know that with the help of Bill and Melinda Gates and many, many private investors, global health has taken advancements that we would not have believed imaginable. Literally a 40% reduction in child mortality in the world. Vaccinations, thank you, vaccinations. There are achievements I don't think we ever thought we would get to. But the people on this panel believe there's a missing piece, and a part of that is around how can we build enduring capacity in institutions in the countries that need it most and the places that need it most, and how can we begin to focus differently on putting people at the center of global health and enduring sustainable work. So that's our challenge for today. Fortunately, we have some remarkable thinkers on that. So I'd like to start with Agnes. She's both beauty and brains. I know the people on her side to be brains, but Agnes, it's hard for many of us in the room to imagine what happened after the genocide and when President Kagame asked you to be Minister of Health, and what you did in order now to make Rwanda a shining example of advancements in health. Tell us a little bit about that journey.
So the most important thing to have in mind, it's not the work of one person. It's a teamwork. But it's even not a teamwork in one sector. It's a teamwork across sector. So one of my jobs was to make sure that in the strategy for reduction poverty and development of the country, health is a high position. So that means the 12 sectors are law, governance, economic development, etc. I have to make sure that I give a portion of responsibility to the Minister of Justice, to the Minister of Transport, etc. So that in a country where accountability is high, if they don't move, I can give the red card like in football. and that's it. So it's and that's what we teach to our students in the University of Global Health Equity. We skill them with managerial skills, because a doctor in the developing world have to develop his sector. And you cannot develop your sector if you don't have managerial skill. Advocacy. We also, the master we give is a mini MBA as well. So to make them, skill them to go to their colleagues, to convince them of the change, to go down to the population and convince them this is the problem we can see together. How can we work on that together? Mm-hmm. Never force, make them buying and be at service, but also to go up and to convince that this is the right thing to do. So those are the skills that are as important as clinical skills, because without that, your clinical skills remain in your luggage.
Mm-hmm. So let me push back a little. It's very hard for many of us to understand how you could really achieve such significant increases in vaccinations, in reductions in child mortality. What you're describing sounds really theoretical. How does accountability real? How do you make leadership teams within a ministry that really work?
So when I talk about putting health in the heart of the development of the country, you need also to convince to have an agenda focused on the people. You need to have develop your health sector focused on community and on response. And also that means you need to educate, and you need also the communities, but you need also to, what we call at the University of Global Health Equity, leave no one out. Mm-hmm. So it's not like public health, the ordinary way to do, where we think as government to do the maximum for the majority of the people with the minimum of money. We do the maximum for the left out, mm-hmm. because the other always find their way to get the service. Mm-hmm. Like I always say, if the grandchild of the poorest woman, grandma in Rwanda, got served, I should not be scared of my grandchild.
Mm. If the grandchild of the poorest woman got served. Victor, let me turn to you. When I listen to your speeches these days, it seems as if you really feel optimistic. about healthcare as a place of great intervention, genetic engineering, precision medicine. But I know a lot of people are feeling really beaten down by the political polarization we're experiencing today in the U.S. So do you really feel like technological advancements and the things that you're hopeful about can flourish in these highly politicized times?
Well, first, Peggy, thank you for inviting me. It's great to sit next to Bob and Agnes and talk about leadership. That's the title of your session today. I say that what Agnes said is so true because leaders have to go well beyond their sectors. I mean, after all, in most countries, they see healthcare as a cost, not an investment. So until you're able to work with your finance minister, your head of state, to understand what an important issue this is for both the health of your population, but also the economy and overall future of the country, you're not going to succeed. So too many health ministers are focused on the delivery of their space, but I think it takes people like Agnes to be able to extend and get everybody to buy in to say this is absolutely important. Which leads to, and I want to answer the question that you asked her, because why the school? By the way, I've been very fortunate to be a family member of your school because, as you know, my roots were with Paul Farmer and Jim Kim. Yeah. Paul and you co-founded this university. I think it's the observation of people like Paul, Agnes, and others that leadership comes with a lot of things besides your own competency in the clinical arena, which is being willing to learn those skill sets and understand the issue of equity and understand the issue of leadership, to be able to have a lot more people, every country to lead and change their paradigm altogether.
Exactly.
And I can give an example. When I came back from Europe after the genocide, I was a good pediatrician. I love my job, but I was not able to save any child because there was nothing. So I had to create the space to exercise my skills, and that's where the thinking started.
So, Victor, the part about, I know you're avoiding the political polarization in the U.S. All right.
Well, I like to put it this way. If you think about the future of health and healthcare and the major drivers of success, we talk about leadership, we talk about resources. No question that, every country needs to invest in health in its future. We talk about making sure the right policy, which are evidence-based, and of course, prevention, social determinants. But one thing I strongly believe is science and innovation. Just think about this. We have doubled the life expectancy on this planet in about a century. Wow. Last 50 years, I'm a cardiovascular person. Last 50 years, cardiovascular death has been cut by 50%. How do we get there? We didn't get there simply because we're good doctors only, but because science moved things along with hygiene, public health, vaccination, antibiotics, statins, you name it. That's the innovation piece. So when people think about maybe this is, too expensive for low-middle-income country, I think they're wrong. Because think about every one of you having a cell phone, an iPhone, and the ability to be connected. And so many people everywhere now are using it as a way to, in fact, monitor and make clinical decisions. Drones, right?
Drones.
And Rwanda, zipline, delivering, blood supply, and now, of course, used for many other purposes, the remote part of it, and retinal scan, being able to look at your diabetes. And all those are low-cost innovations, but high impact. So my strong belief is that science has to be part of the solution in the long run.
Beautifully said. We're glad you're in your role, heading science. Robert, let me turn to you. Robert, you're at the helm of a really important cutting-edge intervention that I obviously have no objectivity about, having been a part of the team to help create it, and many of the people in this room, AMP Health, which is really focusing on this question of how can we, rather than writing off government ministries in some of the poorest countries and saying they're corrupt and unable, how we can really believe in them to be the leaders to own our own development. So tell us a little bit about what AMP Health is doing, what the vision for it is, and what you're learning so far.
Yeah, no, thanks very much, and it's an honor to be on the stage with all of you, and an honor to work with Peggy and the team here on AMP Health. A lot of the AMP Health team is here. Raise your hands.
Oh, AMP Health, stand up.
Yes.
Stand up.
Stand
AMP
up,
Health.
yeah.
Woo, 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 woo.
Yeah, so that's very exciting. So they've traveled a long way from Africa to be here with us this week. It is hugely exciting. Just to pick up on what Victor and Agnes were saying, I mean, we have cause for lots of optimism. I mean, the technological advances that have come and we expect in the future are enormously important. At the same time, I don't think that we'll take full advantage of the potential of those investments, of that innovation, unless we also invest in the people who are responsible for making sure that those innovations reach everybody. Otherwise, we can have the best diagnostics, the best drugs, the best vaccines, the best bed nets, but if we don't have skilled leaders and managers running those programs and making sure that those commodities get to people, I just think we're not taking advantage of what we're investing in. So, I've spent most of my life on the technical side, but I've been increasingly struck that we haven't invested in leadership and management. Mm-hmm. And AMP Health is, at its heart, a leadership and management effort. It's a collaboration between AMP Health and the governments with whom we work. It brings the expertise of the private sector in leadership and management training with our partner, the African Management Initiative in Nairobi. And we work with whole teams. And I think that's one of the secret things. We focus not just on an individual who we pluck out and send to a leadership training and send back. We actually take a management partner, a mid-career professional, and embed them in a Ministry of Health team. The most important thing is that there's demand. The Ministry of Health requests that they want support for a team to develop those leadership and management skills. And it is both leadership and management. You hear a lot about leadership. Management gets forgotten sometimes, but you heard here people talking about management, and both are really important. And we work together to create a multi-year curriculum that covers all of the aspects of leadership and management that you would expect in any private sector endeavor, and we should expect the same degree of excellence in the public sector. So it really is very exciting, and we really try and make sure that everyone in the team feels their responsibility as a leader and as a manager.
Mm-hmm. That's beautifully said, Robert.
And that's so crucial, because if you have managerial skills and no leadership, where are you going? Mm-hmm. If you have leadership but you don't know how to manage, what are you going to achieve? Absolutely. And that's why any clinician that will come out of the university will have the dual degree, global health service delivery, a master, and the clinical service, so that they can manage and they can lead.
Mm-hmm. So let's stay on this point on leadership for a minute, and let me turn to you, Victor. I understand the National Academy of Medicine has a new strategic plan out, and one of the elements calls on a new generation of medical leaders that transcend discipline. I found that so compelling. Tell us what you mean by that.
Well, I think it goes without saying that these days in any field, you really are not confined to the discipline alone, but you require a lot of expertise from elsewhere, scientific, transcending discipline, and many others. So, for example, you think about even in the area of population health, it's not just the healthcare deliverers, but also people in economics, in social sciences, in law, and in urban design, you name it. Mm-hmm. So we really believe, in many ways, along with Agnes saying, that you need to train the future generation with skill set that's broad. And if not, you need to bring in other discipline into the field in order for us to move things forward. And so we're pretty much committed in that particular goal to look at what we call convergent sciences. Convergent sciences is a term that we coined at the National Academies, but MIT is taking it in a big way, and they talk about the future of health as convergent sciences. Mm-hmm. Much of those were emphasizing the fact that molecular research and imaging, big data, computation all come together. Mm-hmm. I wrote an editorial in Lancet to say convergent science also population health and global health, because people think along these traditional science disciplines, but you need to be much broader in order to solve the problem of a population, right? Urban design, transportation, education, jobs, housing, you name it. That's all part of the important. And if you don't bring all those science together, then you're not going to be able to achieve the goals of, as been pointed out, patients or people in the center and being able to advance the health.
So beautifully said. So talking about that in action, it's so interesting. You said transportation, human resources. I don't know if any of you have seen the film Bending the Arc. It's about partners in health work. And there's a scene that our very own Dr. Agnes is in where they're hearing in Rwanda, and she's Minister of Health, that Ebola, some of the first cases of Ebola have been found. And it shows Dr. Agnes literally, I think, like putting 4 card tables together and starting a phone bank, literally, like many of us know, and mobilizing people across the country. And it's very interesting. Rwanda was able to stop Ebola in its tracks. And I would venture to say that it was the way that you showed up as a leader. And so it's exactly what Robert said and exactly what Victor said. But tell us what happened in that moment. And you know the scene I'm talking about.
I know that
so
scene.
there's the phones and they're calling. We found the person here. Tell people who haven't seen the movie what was happening.
First of all, if I have viewed the film before and as minister, I will have cut it. because... No, so I was doing something very casual, and because Ebola was at risk at our borders, whatever place we were supposed to be informed immediately.
Supposed to be what?
Informed.
Informed.
So there were 5 people to inform us, and they say this one call, and he say we have a potential case. And I was literally liquefied inside myself. Say, oh my God. However, you cannot show it. You have to say what to do now. It's to put in place all the things you have prepared for this moment. Meaning, it's really a big logistics. You have the police. All the people to trace the cases were in the police. We had 800 policemen across the country to trace the people and put them in a safe place to save the population. The Minister of Internal Affairs, the Minister in charge of disaster and management, etc., etc., labor, security, all the health sector, inform all the hospitals, all the community health workers across the country, the custom, the border, the telecommunication to give us lines that is our priority and never block. The Minister of Energy to have energy in that place, no stock out. Aviation, because we had to take a sample and bring the sample to another country for confirmation. All the plane, sometimes block a plane. So it's at the same minute. So it's what you saw in the film, and it's the reality, and it can happen everywhere. Remember the case that happened here. That's how our students have to be educated. We cannot be an engineer and a doctor. Yes, it takes years, but the doctor needs to know what it can do with an engineer and learn how to work as a team. So all those, what you described, Victor, the social determinant of health, they have to be informed that each box of this beautiful circle is crucial, and how to use it and how to teamwork with the people who excel in that. And this is the most important. Right. Leadership to be convincing and bring everybody around the table, but also managerial skills to make that opportunity work and work for the people.
Right. Victor, you want to come in?
I was just saying that Rwanda is a really great model for what we call preparedness. In fact, out of the Ebola outbreak, there's a call from UN high level with World Bank to create a monitoring board called the Global Pandemic or Preparedness Monitoring Board, which I'm on the board for. And we do look at exactly this issue. It's not just a health response, public health, but a big part of it is community, anthropology, which you know so well, because every time you look at West Africa and now in DRC, the ability to engage communities is really important. And of course, as you said, military others. In the DRC, Congo right now, the outbreak, in a place where there's tremendous civil unrest and a fragile state, you know, you have to provide security for the healthcare workers. You have to be able to work with the community. So military, many others are also part of it. So it is a multi-sectoral response and preparedness. And Rwanda does really well in this case.
Absolutely. Robert, let me turn to you. The AMP Health Project is working with some of the toughest countries. Sierra Leone has been through both a civil conflict, and Ebola was devastated the country there. Malawi, one of the poorest countries on the earth. But you believe in the power of teams there, and it's different than technical assistance.
Sure.
So tell us a little bit about how you've managed to transform the community health teams in Malawi and Sierra Leone.
Well, it's the teams that have really transformed themselves. It's this commitment. Each of those countries, despite the challenges that they have seen the importance of leadership and management. They recognize that technical skills alone aren't going to get to everyone at the last mile, aren't going to deliver immunizations to everyone that needs them, that they need to invest in the people running these programs. And I think what gives me so much hope is that it's not that AMP Health needed to be sold as a model. There was a huge demand from these countries that recognized that there was this need that Dr. Agnes has, I think, articulated so well, that we need to have skilled leaders and managers. I think the other thing that's coming out in the AMP Health model, which you've heard again and again from both Victor and Agnes, is that it needs to be multi-sectoral. While we're working in health, one of the skill sets that the teams begin to acquire is a recognition that you need to increase your spheres of influence, need to learn how to work outside of your sector if we're going to be successful. And I think that that's not just at the country level that we're trying to drive that, but one of the things that Peggy and I are working together on is putting together a high-level council on leadership and management for development, because we don't think that this is just something that needs to take place in the health sector. And so in the beginning, just before the UN General Assembly starts, this council will have its first meeting, and we're drawing together leaders from health and education and agriculture and finance to drive a conversation that's really trying to, as you say, put people back at the center. Yeah. That just says, it's great, we do need these technological advances. We need to keep driving the innovation engine, yes. And at the same time, we need to rebalance that equation. If you think of it as an investment portfolio, you would never invest everything in one thing. So if we're going to invest a lot in new tools, we need to make sure we're investing sufficiently in the people who are going to deliver those. So we're very excited about this. There's been a lot of traction. Actually, Dan Glickman is in the audience. He's going to be bringing some of the agriculture voice to the table, talking about things. And, nutrition is a fine example. We're not going to reach nutrition goals unless we get different sectors talking to each other at the table.
So let's stay on that point for a moment around changing the conversation. And, we're all sitting here in beautiful Aspen. We have some of the incredible leaders from global health. I've worked in international development assistance for many years, more than 40 years, and there's something wrong with the paradigm.
Yeah.
And I want to hear your perspective on this, Agnes and Victor, which is we continue to see poor communities as an empty bucket that we need to just put stuff into. And then we create these parallel structures of NGOs that are delivering things. And it's almost as if we are approaching it that we don't believe the countries can really handle their own futures. And there's this need for us to be very self-conscious about how we are showing up and how we are in partnership. So I'd love you to start with this, Robert, and then I'd love your thoughts about this. And what's the revolution here? What can we do differently that's better?
I mean, I think it really is about believing in people and also believing that countries have the vision for themselves. The development paradigm, where there's this inherent imbalance in what are called partnerships, where there's an agenda being driven from outside the country, that paradigm needs to change. When we think about the future of AMP Health, for example, we imagine a global collective on leadership and management, because we think the days of a global fund, for instance, where you have a global north funding the global south, those things are going to go away. Countries like Rwanda, the countries in this room, Sierra Leone, Ghana, Malawi, Zambia, these countries have a vision for themselves. They don't need an external vision for where they want to go. Our job is to be thoughtful partners, and where there's a demand, provide the sort of true partnership where we can work with them side by side in developing, for instance, leadership and management capacity to deliver on their priorities and their agenda, not something that comes from outside.
Comments?
Well, I was going to say that if you look, I think the era of which the model that you have mentioned is pretty much over, in my opinion. If you look at the global development assistance in health, it's about $38.9 billion. And if you look at the curve, it's been flat for quite a while now. I think everybody recognized that really now is the time for each country with its great leadership to start mobilizing domestic resources, to work public-private partnership, to create new financing models. This is why I think innovation is so important, because Robert talked about this in very much. I'd like to emphasize the fact we're learning from these countries as well.
Yeah.
When we look at the innovative stuff that people are doing in those countries with no resource, it's amazing.
Yeah.
So we've tried kind of, well, I don't think we introduced the term, but certainly some years ago when I founded Innovation Healthcare, we started thinking about reverse innovation. That is how much our country can learn about efficiency, task shifting, and standardizing the things to do, right? It goes both ways. So I think Robert's absolutely right. Capacity building, the ability to have innovation and leadership and learn from each other, this is the time, right? And I think it's happening.
Beautiful. Agnes, what are your thoughts about that?
I think those two men are right. Because you don't come to my kitchen and say what I have to cook, how I have to cook, how long I have to cook, and for who I have to cook. So international partnership is the same. And whatever place you go, even in a country, you don't come from, if you believe you are an educated person, going to what you believe are uneducated community and tell them, okay, your problem is A, B, C, D, those are the solutions, go and what? No success. And be surprised. So there is a dynamic power between the people who have the money and certain technical skills, and the communities who have a cultural knowledge, a lot of know-how. And if you don't match it with humility and just sit and say, if you have a problem, I can help you. Because if your problem is solved, a portion of my problem is solved too. And sit and give them a voice and make them choose with what we start. You come and you believe that Ebola crisis. Ebola take off in countries where there is no trust between communities, when there is no respect. So people who are sick doesn't go to seek care because they don't trust the care they will receive. And then everybody is in danger. And we don't know what will be the epidemic of tomorrow. So we better be ready, creating trust, respect, and traditional knowledge. You don't know how much we learn when we take the time to listen.
Beautiful. Humility. I'm so happy we have that as a rallying cry. Victor, you want to come in?
No, I was going to say, you probably thought I avoided your first question. So I'm going to come back to this.
Jump in.
The trust in science.
Yes.
The trust issue. I think, trust is so important in everything that we do. But trust in science is so important if you think about the anti-vaxxers today and the issue that I think all of us believe that innovation is going to be part of the important solution. We can't just lead and manage. We also need to innovate. And I think everyone would agree with that. So I was very encouraged by the Wellcome Global Monitor, right? Which just came out last week. And I think it might have been discussed here already.
It was here. We launched it here,
So the numbers in global, 140 countries, 140,000 people were surveyed to ask them about their attitude towards science. And to my great encouragement, if you look at highly trust and to medium-level trust together, that's about 72% of the global population. Now, admittedly, only 20 says, I highly, highly trust the science. But,
only
it's like,
20%?
Yeah, but medium, they believe in it. It's like agree, strongly agree, and agree, right? So it depends how you look at it. I think the key issue is to maintain that middle level of 50-some% who says, we believe in science, medium, this is the... But, and make sure that they continue to have that deep-rooted believe in science.
Absolutely.
Right?
And this is a
but
big
the
part of
link
your
also-
job, Victor.
Yeah, the link also is they believe in science when they believe in their government, when they believe in their
Exactly.
institution, when they believe that they count.
Yes. So exactly. So in health, the good news is 70-80% global now, every high, low, middle-income countries said they actually trust the health providers and the health system. And I think that Agnes is so right. That is, if you look at determinants of people who believe or not, it is related to education, to some extent in their income, and certainly trust in their institutions. And we need to create that trust in our institutions.
Absolutely.
That's what we've been trying to do at national academies.
Right.
Peggy, can I just
yeah,
jump? Yeah, just
please.
to say, I think this issue of trust is central, and I think the words that you're hearing up here aren't the words we've always heard in global health: humility, trust, listening. These, I think just to link together the wonderful things you both said, I mean, the most important way to begin to build trust is to listen to the people with whom you're interacting. If we don't listen, then how are people going to trust us? And, when we have our theory of change in AMP Health, actually the beginning of the theory of change is establishing a trusted relationship with our ministry partners. Because without that trusting relationship, where are we going to go? I learned from Dave Milestone, who's here in the audience, a wonderful phrase, which is that progress moves at the speed of trust. And I think what we're hearing up here is that that's really true, and that needs to be that can't be an afterthought in development. It needs to be central.
Right. So you all represent that, the gold standard of this. But Victor, in your role as a National Academy of Medicine, you are responsible for making sure that people have access to evidence and database. And all of you know that wonderful word, truthiness, that Stephen Colbert talks about. And, at first it was really funny, It's not so funny anymore with anti-vaxxers and measles on the rise. Has your job gotten harder in the last 4 years with this question of truthiness? But maybe there's a less friendly word that we're all experiencing right now, which might be, I think someone on this stage, Lana Wen, said lying about science. So,
well, I just gotten busier. I think we've for many years, as you know, a source of great evidence, report recommendations to Congress, to the U.S. government globally, using evidence-based. And we've always felt that we've done a good job in doing so. But we recognize increasingly that we need to do a lot more than just doing those. So we've really redone our communications approach. Our reports are more focused on the issue of getting trust, right? Scientific reproducibility, objectivity, and how to actually communicate with the public. And we have a project with Google, which is still in pilot, called on misinformation. So Google came to us say, when we look at the most searched areas in Google, right? We don't know how, in fact, factual they are, and can we do something about this? So guess what? Of all the many areas that are being searched, the top 5 in science, engineering, medicine are in health. So we actually begin to work with them to look at how we can partner with them in providing evidence and a counter misinformation kind of effort in looking at getting the very best experts and push forward both through Google search that you find the right information, hopefully it will rise to the very top of your search, but also using a whole series of media, social media, electronic emails, website, and many others push this information out so that the public can know more about what's important.
Excellent.
If I can say one word about our strategy in convergent science, one important aspect of science and technology is the concern for equity. And we have to acknowledge that, right? The tremendous advances which may make it unaffordable, people have no access to, etc. And of course, that's one of our big areas, looking at the ethics, social sciences, costs, etc. I want to give a shout out to Senator Cassidy back there, because he's been working so much on the drug pricing area. Certainly something we work with him on, looking at how do we make sure that we have a good framework to determine what would be innovation that's affordable. And I think this is a really important area.
Beautiful, thank you. I want to open up to all of you. And Dan Glickman, Congress, has the the Honorable Dan Glickman, former Secretary of Agriculture and Congressman, and my friend who's teaching people about Africa every day. Let's bring the microphone there, and then others of you just raise your hands, and we'll bring the mic to you. Dan, thank you for being with us.
It's such a great honor for you three experts. So I've been involved in food and agriculture all my life. And it's the one area that's hardly ever mentioned in high medical circles. Mm-hmm. So recently I was at a panel of distinguished scientists from medical doctors from all over the world, and the issue was non-communicable diseases in the developing world. Nutrition and food was not even mentioned.
Yes.
No way.
Yes.
Yeah, I'll tell you what was mentioned.
Yes, right.
Cigarette smoking, reducing, obviously very important, and getting pharma, drugs into the world. And, there's the African proverb, of course, I don't know it all that well, but food is medicine and medicine is health. And sometimes I think that food and health are not mentioned because it's not viewed as perhaps as sexy of a subject. Or maybe the science of food and nutrition is not where it needs to be. But I always heard, my mother used to say, take your medicine with food, otherwise it doesn't work. So I'm a one-horse pony on this issue. You are three leaders in the world. Don't forget the importance of eating, and what you eat is part of the health of the developing world.
Food and nutrition, please.
Yeah. In fact, I would say this is very high on our list of discussion. Mm-hmm. Aspen Health Strategy group, which I'm part of before this thing, talk about antimicrobial resistance and the importance of One Health. Agriculture was clearly, and farming was part of this whole discussion. Gene editing. We'll have a session at noon, which I'll be participating. In gene editing, the whole issue of gene drive, and in fact, in looking at how to apply it in agriculture. Social determinants of health, food security. Believe me, we're talking about food. Very much on our mind.
Great. Let's take some more questions, please.
Bob, I've talked about agriculture ministers.
Right. Yeah, we really think that this conversation needs to include food and agriculture. Absolutely.
And in our university, we have an institute of One Health, environmental health, human health, animal health.
Okay. Good. Where's the mic? We have a question right here if you want to stand up, and then Mohit, you can be next. Anybody else want to? Okay, we'll take the next one, please.
Good morning. Thank you for the discussion. My question is about gender equity. So we know that 70% of the global health workforce is made of women, but only less than 30% of the health leadership positions are held by women. So I'm curious, in your programs, what sort of interventions are being done to help more women from the front lines access those places of decision-making power?
Great question. You're not a plant, but this
so
is...
maybe
please, Robert, you first, then Agnes.
Yeah, let's start with that. I think you raise an incredibly important point, and part of the way we are trying to deal with it is make sure that we deal with whole teams, because the teams actually do have quite good gender balance. So if it's not just plucking someone out, who's often the man who gets plucked out, but training a whole team and bringing that team along together, then I think that's a very good way to address the equity issue. The other thing is how you put together a board. We have a board for AMP Health. It's 13 people. 10 of them are women, including our chair, Wendy Taylor, who's here. So that's another way where we try and show that the leadership women need to assume a much greater proportion, ideally more than half of the leadership positions in global health.
Right, and yes, we're kicking it
I'm
up.
a woman,
and one of our board members.
I'm the lead of my university.
Yeah.
We have just recruited the first cohort for medical education, 70% of women by purpose. Mm-hmm. Because it is a symbolic, but it's a message to the world. We also have, in the university, we are going to have the third conference on women leader in global health. It will be in Kigali, Rwanda. The first was in Stanford.
You're all invited. It's really beautiful there.
Yes. And we push women, first of all, because they are the ones who give the maximum care at home, and the nurses, the doctors, etc. And the power imbalance need to change. And there is also a lot of data, economic data, showing that when you promote women, money comes starts to. That's true. And with that money, you create health.
So if I can say a word, at National Academies, as you know, we are the Academy. Our average age of our members is about 70 years old and mainly white male. This past year, our class is 42% women, 25% less than age 50, and 28% minorities. So we're really working hard on diversifying, introducing a lot more diversity inclusion in our academies, which obviously, in many ways, is the kind of intellectual center of health, medicine, and sciences. But I think we are certainly making our effort to make changes.
We have a long way to go. It's really, I thank you for that question. It's so important. Mohit, please, and then the gentleman after that. We have a mic right coming to you, and then the gentleman with the... Yeah, please, Mohit. Mohit's one of our management partners. Please.
Thank you for this powerful narrative and the illustrious background that you bring. It's weight to the power of storytelling, because sometimes stories can just be that, stories, but this is your life. One of the things we talk about in primary healthcare is putting communities at the heart of their health, people at the center of their health. We've talked a lot about leapfrogging here through paradigm shifts and innovations. How do you empower communities to be put at the heart of innovation? Because innovation, as we are talking right now, CRISPR, gene editing, that's not the only form of innovation. It's communities who are finding ways to overcome drought, communities who are finding ways to overcome land blockages to send their kids to school, communities who are looking at local resources for nutrition. How do we empower them to be at the heart of innovation? How do we recognize that that's innovation? And how do we systemize the diffusion of innovation in the context of the countries we work in, so that we don't always have to look to the global north for innovative solutions? Beautiful question.
Yeah, so if I may, I think a lot about that issue. And in fact, as you point out, you put the community in the middle, you enable people to find solutions, and there are lots of people who are ready to do so. You help them and give them assistance in terms of resources, and then you try to help them scale and replicate. So there's obviously so much of this driven by need and market. And so understanding that is a center by which you can enable innovation to succeed. So about 10 years ago, I co-founded an organization called Innovation Healthcare. It's run by Krishna Yudhaba Kumar. It's between Duke, McKinsey, and World Economic Forum. What we did is we scanned the entire landscape, north and south, for innovators who are trying to find or who are finding solutions for low-cost solutions in healthcare. And there's lots of great ideas. And we create a forum for them to come together. And importantly, we bring investors, industry together for them to pitch and help them scale, replicate. We help them to write business plans. And I think in providing some of these skill sets, the innovators will be able to kind of break out of the mode and able to now move further higher. I think the whole point is when you have a great innovative idea, replication and scaling is critically important, right? And this is what we try to do, and I'm sure you have lots of other ideas as well.
Robert and Agnes, community at the center. Tell us what your thoughts. Robert, let's start with you.
Yeah, I think it goes back to what we were talking about before. It's about listening. So we need to listen for good ideas. They're out there. And we need to trust. We need to trust that communities actually have a vision for what they're trying to achieve. We often go into communities sort of saying, the glass is half empty. What are you missing? And there's a wonderful book out of community development in the United States called Building Communities from the Inside Out. And the idea is, how do you go in and listen and learn what the community's ideas are and figure out what are the resources and extra things they need to launch those ideas and fulfill the vision they have for their own communities.
Right. Agnes, you want to come in?
I'm not going to add to what you say. I just also want to say that you need to make the community prepare to have their own demand. Yeah, and this is also education. And now use those technology to educate at distance. Information, etc. What we do also, create humility among the people like you and me, who have the chance to eat correctly every day, a little bit too much, but also to get access to all information, etc. Just be thankful and share that and be at service of community. Then innovation comes, and they will help to improve innovation.
Beautifully said. So I'm getting the hook. We're all out of time, I think 0 minute. And this gentleman in the orange didn't get his question asked, so could I invite you to come up and talk to these guys after? But I really want to thank my panelists who are brilliantly and tirelessly working on this, the people in this room that are working so hard on these issues. Thank you so much.